Alright, the teams will have to work with limited equipment on the surface that's not... Oh, wow. You and your team are working a first aid team at a popular river canoe relay. Towards the end of the day, you're asking to keep back away from struggling teams. You see canoes happily pass about, and when you're about to leave, you hear some shouting coming from upstream. When you look, you see two people in a canoe who appear to be in distress. You only have limited first aid packs and whatever equipment you find in the canoe. Victim 1, a 26-year-old female, is shivering with cool and clammy skin, wet clothing, several welts on arms and face, and apparent bee stings. Has large laceration on forehead with moderate bleeding, and has large deep laceration on left thigh with severe bleeding. And they keep asking if her baby's okay.
Victim 2, 32-year-old male, numerous bee stings on the face and arms with stingers still intact. Patient is having obvious labored breathing and has apparent angulated fraction of the lower right leg.
Can we get a sheet, Judge?
You can rip off.
Yeah. So what they just said, we're going to call police, fire, ALS. We're going to contact the canoeing agency to see what's going on there. Is there any? Are they on shore?
Yeah.
Judge, are they attached to the shore so we can get to them? Or are they floating down the river? All right. Well, we see two patients. We got our kids.
I'm in the river. That is the bank side.
So they are on the bank side?
Yes.
Okay. All right,
It was two Raven.
Call case fire ALS. We got our gloves on. We got our kids' clothes. We're gonna go assess any patients. They said they were looking for the baby, is what we're hearing. We're gonna look for a baby. Do we find a baby anywhere? Judge, do we find a baby anywhere? Huh?
No, no baby found right now.
No baby found right now. Okay. And
They said something about not having any supplies. You can have your supplies, being that we don't have a bag of supplies for you.
Do they have a bag of supplies? In the
You
canoe
have
too, Judge?
whatever you have with you
Whatever we
this
have?
time.
All right. And then, so Nick, you want to see how they're doing with their head? You want to grab the supplies real quick? Chris, you want to go over there and grab the head?
Do you want me to help? Hello, ma'am?
Nick, do you want to deal with her left leg laceration?
Okay, head, left leg, I need some bandages, left leg, and head.
you doing today?
I'm gonna transport victim out of the canoe.
Okay.
Is this patient?
Can you stand for me today?
Stand up?
Yeah? Can she stand, Judge?
Transporting.
Yeah.
Do I got an airway? I got breathing.
Lay down. It's the first victim or the second victim?
This is the second.
Okay, no, it's the first.
You're the female?
Okay,
Well,
your patient.
you're cool, Franny. She's patient too?
She's patient.
Nick, do you want to grab me a 4x4 so I can stop that large bleeding on the left leg? So, can we move her out of the
We need a splint.
canoe, Judge?
1 second.
Go for it.
Okay.
Lower right leg. Lower right leg fraction.
All right. Well, I'm going to take some 4x4s real quick. Left leg, where is it? Nick, where's the laceration on the leg? 4x4 on the left leg.
Left
Is
right
bleeding
leg.
stop?
Okay, we're gonna need a bigger splint.
Can you rip off your page for me too so I can work it too? No, not that one.
This is so confusing.
Yeah, that's why we had to do it.
What is
No, not that one.
sinuses and allergies? Does patient number 2 have allergies? Any
Yeah.
allergies?
Left thigh, is bleeding stop, Judge?
Yeah.
Yeah?
Bees? Okay, do they have an
All
EpiPen
right,
on
and then so I'm going to need a blanket. Chris, you want to pass me that blanket real quick? So since she's shivering, she's got large
the
welts.
patient asking me to put the EpiPen?
How's her airway doing? Do I hear any like wheezing, anything like that?
Okay.
Cover her with a blanket.
Am I allowed
Judge?
am I allowed to use the EpiPen?
Huh? So the bleeding didn't
So
stop?
I'm allowed to use it?
Okay, well then I'm going to go to a pressure point.
No.
Does it stop now?
I will assist. I
After I
will
apply more 4x4s?
help you need EpiPen.
Okay. And I'm going to come down here.
And impression.
EpiPen.
And a pressure point?
The bee stings are still in, the stingers are still in. I'm going to take a credit card that I had in my wallet and I'm going to scrape them
Can you
out.
toes? You feel this? Please come over here with your hands. Will you hear? That pulse. So we're going to have to cut off her clothing since it's all wet. We're going to have to move her to someplace warm, which would probably be our ambulance. Warm her up and
checking her
so, huh? Dude, did you see it on the sheet? Look on the sheet, man. She got a broken thing.
Okay, checking pupils.
So I got an airway. Probably going to want to put on oxygen 15 liters per minute.
On the forehead.
Second.
Checking airway.
Does she accept? Do you accept the airway mask and a breather? Yeah. Okay.
I'm supposed to talk.
Yeah.
And then does
Doing
her
a
breathing
full
seem
body
labored by the bee stings?
Back of the head. Checking face. Checking neck.
Okay, so I'm gonna look for other bee stings. If I see them
Checking
scrape on the
shoulders.
credit card. And
Underneath
then
pushing,
watch
checking
yourself
arms.
together. Make sure not to aggravate. Are you allergic to bees?
Checking hands. Checking fingers.
Yes.
Do you have medication?
Checking
for
ribs.
bee stings?
Checking chest.
Epinephrine.
These are different. These are a little different.
Checking abs.
Medication.
Checking the lower back.
Okay,
Checking the hips. Checking the thighs.
Oh, she has
There's
no
a
allergies.
deformity on the right leg.
End of immediate action.
Okay. We repaired. How's the right leg doing?
Nick, how you doing over there?
We're doing good. We repaired the right leg. Put our EpiPen in. Scraped all the bees out. So we're doing good.
You want to put on some oxygen too?
Yeah, we're gonna put on some oxygen. Put on oxygen.
Okay.
What are your settings?
And so you said you have a baby. Where is your baby? Do you know where the baby is?
Oh, they didn't.
Yeah, we can talk.
Down
Yeah.
in the water?
Yeah, they're covering that next week.
Baby.
Yeah.
Next week?
How old is the baby? Do you know?
Right side.
6 months.
Well, is it a
Some
fracture?
How long ago did the baby fall?
10 minutes.
Make sure it's not directly on the skin now.
Yep.
Not putting
we have the baby?
skin on. Let's see.
Billy.
We have the baby. Yeah.
I'm gonna ice the leg, just not directly. on
There's
the
no
skin.
baby yet.
And then we're also going to put the ice on her last
And
one
then-
too. Slowly.
Okay,
And then I'm
How's checking pulse again?
Is it broken?
Checking
No, it's not
pulses.
broken. It's not broken.
And the respiration or the pulses?
Oh, I mean, 110 rapid.
Okay. And
It's just.
breath
Respiration same.
respirations
32.
and the skin.
All right, Judge. Is it all ready for
Warm and dry.
Okay. And pupils.
Pupils are equaling
You know if you feel anything
Okay.
besides that laceration before.
Now rapid. Okay. Huh?
You need anything?
Ears.
We have rapid. I put oxygen on for respirations, 32 in labor, and pulse is 110 in rapid. So okay.
The oxygen still working?
That's probably from the allergies. The EpiPen will have to be kicked in. Has it been 10 minutes? Can I apply another EpiPen?
You want to need
Or has the pulse or anything changed since I put the EpiPen in?
push in pain? No?
Pulse remain the same.
Also remain the same after the
Can you
EpiPen?
check your groin for me? Is it good?
Is there, what did she
Go down the legs. Anything on the legs besides your laceration on the left leg?
Okay, did she have any other
Which is being
medication or
controlled?
allergies other than?
Do you want to wrap it up though, so it stays?
Yeah. And any past prior history?
The ankles?
Any events prior?
No? Okay.
Knocked over,
Go down the
behind,
neck.
received several stings
Anything in there? No?
on board with it.
And the beehive is awake.
Did they crash into anything?
Uh,
And they go back
is there
up?
any swelling in the throat?
Any pain now?
If she can breathe, it's fine. Pulse is rapid.
Push down the tip of the fib. Tell her, go back. Up. Check your groin for me.
Release the kid.
Back.
So the only fracture was her right leg. I did the whole body sweep. Did I find anything else?
Go down the chest again.
Okay. Did you do MSPs?
Yeah, gum in there.
Push your leg up,
Ears.
down.
Forehead. And walk on the arms. Anything on arms?
Okay. What could I? Hey
Are
Riley,
you still cool? Yeah.
rapid pulse. EpiPen didn't work, or it hasn't slowed the pulse down.
No, how's the breathing?
Breathing's 32 in labor. EpiPen did not affect.
How about when you're sitting her down like that? Maybe sitting her up?
Sitting victim back up.
And that's when you're a little late in there.
Yeah, there.
And so simple.
After I sit the victim up,
Do you have anything? No.
does this affect the pulse or breathing at all?
Symptoms? No?
Is there anything else you can do?
You want to take a set of vitals?
Oh, would that actually help?
What's that?
That help?
Doing what?
Or just keep monitoring?
It doesn't say anything on here.
Can you take a deep breath?
EpiPen should help with breathing. It would elevate the pulse would actually go up with epinephrine.
Okay.
Giving adrenaline would increase the heart rate.
I would say improve. It
Improve.
doesn't say anything on here.
No pain. Just
Okay.
it's on there. Put ice on it, slow it down.
Is the ice still on?
Okay.
Yeah.
And then allergies. You
Should
have
be.
no allergies, no medication?
Okay, just resting the victim, making them sit down, monitoring.
Yeah. Was there first pregnancy?
Is there anybody around that knows anything about these victims?
Oh, they're by themselves.
Yeah, because you probably did it for a while.
Billy, 10 minutes?
How you doing over there, Nick?
Yeah, we're still trying to figure out this.
No, I'm
rapid
telling you
pulse
'cause-
and-
Oh, you wanna go?
But no, what is it
Down
saying
the
there?
adrenaline, I think, is
Yeah.
what's causing it. So
Okay.
just
Take a set of vitals here. She's doing that.
yep.
When did they get
Okay,
the
checking vitals for third time.
15?
Judge, checking vitals third time.
Okay.
Pulse.
Any water?
Pulse is
Yeah, you went
under 10.
Okay, and respiration.
Just so you know.
32 in labor.
32 in labor still. Okay, and the skin.
140. Warm and dry.
Okay, and
Nick,
pupils.
what you got? Hey, Chris, what's going on with that patient with that?
People interactive. Okay.
She had a right leg fracture and then stings on the face.
And she was allergic to bees, so we used EpiPen we found in her pocket. We assisted her with that because I am not trained to do so. We we split the right leg and put ice on it to cool or slow down the swelling. We scraped the bee stings out after we put the EpiPen
So
in.
she's having problems breathing too?
Yep, I think it's just because of the adrenaline though, so we're just resting
Put
her
her on the
now.
backboard?
Huh?
Put her on the backboard?
Yeah, we want to put her on a backboard. Okay. If I can have you lay down.
Which side do we want on? We're on that side, right?
Well, that's the bank. That would be where the water was. We would want.
So we're gonna have to move it this way. Chris, you want to slide her over? Nick, you don't have to hold the head. You didn't suspect the head injury, did you?
What? Yeah.
Do you want to grab her by her broken leg, Nick, Chris?
Oh no.
Okay, so go by her hips.
Okay, ready? 1, 2, 3. No, keep moving. Here, pull a little
And
more.
slowly.
Yeah. There you go.
Slowly. Is that good?
Yep. Okay. You got the C collar over here somewhere?
Do you want to put a seat collar on?
Yeah, let's put a C collar on.
Okay, Chris, you want to help him with this? You want to undo those straps? How you doing over there? You sandbag.
Yeah, we could.
All right. Chris, we're going to want to put it on this side because we can't roll around that broken leg. Okay. Switch it. Do you know by chance putting a blanket down for padding so the patient's more comfortable? Is that acceptable?
Yes.
Huh? Changing gloves, Judge!
Okay.
Is that good? You can do anything right here, I'm gonna do right here, and I'm not gonna want to grab on that. But you're gonna have to.
How you doing?
How you doing, patient? Name Brianna, that we just made up for you.
Yep.
Somehow matches.
All right, you guys got your first note.
First note,
First note.
when assessing and treating your victims, you see what appears to be a small infant washed up on shore. When you retrieve the baby, you find it to be approximately 6 months old male who was pulseless at night. The patient is also cold and touched and skin is free. You want to finish with this? Nick, you can use sandbags to do that. Put it on that way. I'm going to go over here.
Okay, yep.
Changing gloves again, Judge!
Let's go, ready?
All right.
3,
See
1,
safe. What do I got here? I got one patient. All right, I'm gonna call help. We still got help here? Yeah? I'm gonna request a firefighter to come over here and help me too. I'm gonna check for a pulse. Break the pulse. Did I find one?
Ready.
Pulseless? Nope. I'm gonna check for the airway. No breathing?
1.
All right. I'm gonna call somebody get me an AED. This baby's having trouble.
No, back
Okay?
up 1.
I'm gonna start with CPR. And I'm gonna do 2 fingers right in the middle of the chest. Okay.
Okay, we need a slider down. On 3, 1, 2,
Breathe.
Come on, guys.
Nick, how you doing over there?
Doing good. Getting a patient on the stretcher or on the backboard.
And judging baby track.
Yeah, that's. You need it here. 1 second. Let's roll it back.
Breathe. Breathe. Chest rise.
Don't put your neck. Just leave it like that.
Did your AED arrive yet?
We need to move the backboard down first.
Do I get an AED, Judge?
Not yet.
Not yet?
Do you do anything about the well? You should take that out.
Breathe, get in clear chest rise. Baby, you're gonna live. Your name is gonna be Tommy. Tommy boy.
Girl.
Huh? Your name's gonna be Tamina.
You ready? No.
No?
Nope.
Well, I'm gonna have to move this baby into
You need
the
to pull
warm
the
ambulance
backboard on
area.
this.
Warm it up because it's cold. How long has it been in the water dry now?
Here, hold the backboard down there.
10 to 15 minutes before contact.
Okay, yep.
Okay,
No,
so it's
don't
been
hold
about 2
her.
minutes. I'm gonna recheck.
You're gonna wanna kind of have to lean over here.
No pulse? Probably no
Okay,
breathing, but I'm
hold
checking
down on
anyways.
3.
Breathing?
1, 2,
No.
3.
Keep going. Waiting for my AD.
Okay, pull up on 3. 1, 2, 3. Okay, this victim's on. Okay. This victim's halfway on and halfway off. This isn't gonna work. We need to put her up again, even though it's like we need to get this backboard under her. Okay, ready? 1, 2, 3. Okay, get it all the way. Okay, now we're gonna 1, 2, 3. Okay.
Allison.
Now put her. See where how her legs are spread apart right now. Put them together. Close them.
You want to help me rescue the baby? Oh, okay. Slide the
Okay.
baby over.
Ready?
2 patients.
1, 2, 3. Okay. Now straighten her legs. Straighten her legs so they're both on. Okay. Now up on 3.
Wait. Armpits. There you go.
On 3. 1, 2.
Hey, hand him note number 1.
Okay. Do we have sandbags? Do you guys have sandbags over there?
Here's one.
Okay. Now chest first. No, let me stick your chest first.
Paul, do they have? Tell them to take off the headlock.
They took off the headlock.
Nick, why'd you take off the headlock?
Huh? Head block? Because it was getting in the way when we backboarded the patient. We had to remove it.
3. Baby, I'm trying my best to save your baby here. Chris, how's she doing? Nick, how's she doing over there? Reach out for the third time? Yep. Yeah? What'd you get? Yeah?
Eyes are reacting.
Breathe. Do you want to redo everything? Yeah. You want to check to see if that's good, see if that's good. Oxygen, hold on to me. After this stretch, give me 2 minutes, and we're going to recheck. Breath.
Can you hold your arms like this?
Check.
Can the patient... Judge.
No breathing.
Judge. Judge. Can patient hold her own arms on backboards?
Patient conscious?
Yeah.
Then yes.
Okay. Okay. Judge. Judge. Checking vitals again. Pulse.
Is this baby getting warmer? Nicer skin? No?
Respiration.
Still pale and blue? Try my best.
Respiration drip.
That's well.
Chris, keep talking. Keep talking. We'll
And
find
the
out,
skin
ask
drip?
questions. Keep it talking. You don't actually want to...
And pupils.
Breath.
Okay.
When you're cold, you're warming up now.
Okay, sandbags.
Just talk. Tell her about
Do
your
you
day.
think
Ask her about her day.
do you think you can monitor her while I go help with?
Talk. Yeah. Just think it's me.
Okay, sure.
Your day is great.
Here,
Because you on the water.
gloves.
Change your gloves.
Yep, changing gloves. Judge, changing gloves.
Patient. Reason why you guys went out canoeing?
Wait. It's like this.
Okay. Breath. Breath.
Swimming. No, I didn't want to fall. Now she wants to go swimming.
Do you have any family?
Chris, do you want to start?
Do you have any dogs?
Strap her head in?
Breath.
Strap her head in?
Okay.
Any dogs? You know the name?
Breath. Breath.
Coco and Mojo.
Judge, after this one, check.
Breath. Breath.
You check your pulse?
No pulse.
No pulse? No breathing. Still going. Do I still get an AED yet or no?
No, you're good.
5, 6, 7,
2-minute wrap up?
11,
Right.
12,
Team leader, want to give me a 2-minute round?
Breath. Breath. Me.
All right, I'm going to request we do the
Yeah, I'll take it.
switch. Okay. What we found. Patient 1 here, approximately 26-year-old female. She had a large leg bleeding gash. We suspected a video laceration. Wrapped it up, applied focal force, bled through, added more focal force, bled through. We added a pressure point, stopped bleeding. She had a laceration in her forehead, about 3 inches long. We wrapped that up with 4x4s. Bled through, so we kept wrapping it up. Did not suspect a head injury, although there was a laceration of the head.
Breath.
And then, so what she was saying, suspected that she was alert, or verbal, and couldn't really give us some solid answers. Mike, what'd you get for pulse?
I got 110.
110? Okay, 110. Respirations?
Breath.
Respiration.
One.
Okay. Pupils?
Two.
Equal and
5,
reactive.
6,
How about BP?
8, 9, 10,
Blood pressure?
12, 13, 14, 15.
130.
Okay.
Breath.
And the time is
Breath.
2:45 in the afternoon. And so this producer right here was a 6-month-old baby that's complaining about found her in the river. She's IP'd, pulseless. So cardiac arrest is what we suspected. Requested an AD didn't give up. I've been doing CPR since we got found in the river. Patient 2 over here was a 30-year-old male, suspected head, neck, and back injury, had a fractured tibia. So we splinted that, then applied a backboard because they were more critical with the labor breathing. So we figured it was a load and go instead of a stay and play. And so that was alert. You're asking questions. Sample, not real sure what the sample was. Sample of this, no allergies, medication, past medical history, was had baby 6 months ago for a pregnancy. Last oral intake, trail mix, no choice canoeing. Same with this patient. What'd you get for allergies over here?
Bee stings.
Bee
Bee
stings.
stings, medications?
EpiPen in pocket. We assist the patient.
Yep. And then last medical history?
Huh?
Or past medical history?
No past history. Last oral intake. Didn't.
Trail mix.
Yeah, trail mix.
And election.
Bam!
Okay, can I please get out? You guys
Yeah, you
are
can.
so terrible.
How we gonna do it?